November is National Lung Cancer Awareness Month. That is a continually growing problem in this country. And we're so happy this morning to have some help and advice for you because Dr. Krish Bhadra is here. He is with the CHI Memorial Buz Standefer Lung Center and an interventional pulmonologist. Good to see you again.
Good to see you again as well.
So I think that when most people hear a diagnosis of lung cancer, there's a real panic associated with that. Is that an accurate response?
Yeah, I think whenever patients come to see me, they have a lung nodule or a spot or lymph nodes in the chest that are abnormal that came up on a scan, whether it's a screening scan or whether it's an incidental finding on a CT scan or a chest x-ray that have been performed. And so it's not a real emergency like a heart attack where time is of the essence, but time does matter. And what we found is that it takes on average in a community hospital to get a lung nodule or a lung lesion that's positive for cancer worked up the average is 90 to 180 days.
Wow. And
cancer doesn't take a day off. And so what we've done is we've created a system at Memorial, at the Buz Standefer Lung Center, where we can fast track patients through the system and be able to get them to the front of the line and make sure that they get their biopsies done quickly. And so that's one of the things, alleviating that panic, alleviating that stress is really important for them.
In terms of being at the front of the line, it's not just the patients who are at the front of the line. Memorial's kind of developed this reputation over the years of being at the forefront of new technology and screening options that are out there. So y'all have something called a fluoronavigational bronchoscopy.
So we have a lot of studies that we're doing at Memorial Hospital, and fluoronavigational bronchoscopy is a type of bronchoscopy where we use fluoroscopy and we synthesize images that are 2D into a 3D image that allows the provider, a person like me, to be able to see the lesion easier and then be able to biopsy it and have a more accurate diagnosis. And so what lesions that we couldn't go after before, now we can go after. And so that opens the door for patients to get biopsies in a minimally invasive way. I always tell people that bronchoscopy is one of the most humane types of biopsies, has a very low complication rate, and can afford the patient the opportunity to know what they're dealing with and do it in a safe manner with a quick recovery.
So is it true or false that most people who develop lung cancer were smokers?
So that's true. So 85% of patients with lung cancer were previously smokers. However, 15% were not. And what we found is I think that we're realizing that we've been missing a lot of lung nodules and non-smokers, and they're usually female predominant. And so there's some genetics that play, and we're trying to figure that out as we go along. But it's certainly not limited to just patients that smoke. How
do you know when you ought to go get screened for a nodule? Are there some symptoms that you have that would bring you to a pulmonologist to say, I think I have a problem here?
Well, I think one of the things is if you're a smoker, and if you smoked for a long period of time, your age is, you've smoked for at least what we call 15 pack years, which means, or 30 pack years, which is the number of pack years times the number of years that you've smoked.
Okay.
And then if you've quit within the last 15 years, or if you have a spot on your lung, then those are all reasons to go ahead and get that checked out. We do have a robust screening program at the Buz Standefer Lung Center. We even have a mobile CT screener that goes out into the community, so we can actually bring the screening bus to you and make sure that we can look at your lungs and make sure that you're okay.
I know that you're here talking about lung cancer, but we have a lot of just pulmonology issues in the Tennessee Valley, don't we? Is it because of the allergens that we have here in part?
Yeah, we're at the bottom of the Cumberland Plateau, so we are predisposed to have a lot of allergies in this area. And I think we rank nationally in the top 10 as far as sites for allergy and lung diseases in general, with particularly to just allergy, but lung cancer itself is also very prevalent here.
If you find that you've had a diagnosis of lung cancer, or you're afraid that you may be experiencing some symptoms, can they come to you for a second opinion? What's the involvement in terms of getting an appointment at the office? Can they just simply self-refer?
They can self-refer, they can get a referral from their primary care physician, they can ask for a second opinion. There's always an opportunity for patients to come in through the door and get worked up in terms of trying to figure out if they're getting the right care for them. And we're very respectful. Even if it's a second opinion, we can send them back to their primary pulmonologist.
As you said, cancer does not take a day off, so time is critical.
Time is critical, and so we like to shorten that. So our goal is to get somebody who has an abnormal lung lesion from time of discovery of the lesion to diagnosis and to treatment, all compressed into about a 3-week period. And that way we can help help their survival rates and what we call stage shifting, which is we want to catch the lung cancer early. So Memorial has done a great job of being able to detect lung cancer earlier and treat them earlier. To give you an idea, so the national average for lung cancer, stage 1 and 2, is around 31%. 2 years ago, we were 52%, and so we track that on an annual basis.
Let's get you to them. Here is their phone number. It is the Buz Standefer Lung Center, 2 locations, Chattanooga and Hickson, 495-2635. Go to memorial.org/lung for more information. Thank you so much.
Thank you.